You look fine, but you're not fine. And that's exactly what we're here to talk about. Welcome to Fine, But Not Fine, the podcast about navigating rare disease, healthcare battles, and the messy reality of chronic illness. I'm Kelly Paul, and I've been living with mycosis fungoides since 2015. This is a space for real talk, real experiences, and practical advice. Because surviving is one thing, but figuring out how to actually live, that's the hard part. Managing multiple doctors. Have any of you been able to figure that out? Because I sure as heck haven't. I'm telling you, if you have ever felt like the project manager for your own body, juggling a team of specialists, team of doctors that do not seem to talk to each other, this episode is for you. Because honestly, it is complicated and goodness, it is exhausting. And like many things with chronic disease, it feels like another one of those second full-time jobs. So when you have a rare disease, you generally don't have just one doctor. You have a primary care physician. You have your specialist. You may have several. It may be a dermatologist, an oncologist, a rheumatologist, gastroenterologist, or cardiologist. We know this list could go on. And each one of these specialists focuses on their part of your body, their slice of the whole big puzzle. The problem is nobody's putting the whole picture together, and they all mean well. They're all experts in their space. But this healthcare system is built into these crazy silos. And as rare disease patients, we do not fit neatly into those boxes. And we're left as the ones connecting the dots. So what makes managing multiple doctors so hard? I'm going to tell you there's several things. Conflicting advice. One doctor says to increase a medication, another doctor says no, or it needs to be decreased, and you're stuck in the middle wondering whose orders to follow. And I've had this with a couple of things. Cholesterol medication specifically. A lot of the medications I've had to take for my lymphoma treatment raise my cholesterol, or a component of what I call cholesterol, because there are multiple things that make up cholesterol. And my lymphoma doctor might say, I want to prescribe you drug A, and the cardiologist says, no, you really need to be on drug B, or I'm not going to increase it, you shouldn't take it at that point because of reason C that I'm not aware of. And it's all based on the science and this that they have. And so you're kind of trying to figure out between the two doctors and communicate, well, yes, you said to do A, but this doctor said not to, and this is why. And then trying to figure out what the heck you do. And it can be really frustrating. I've also had it with medication that I take for thyroid. I take thyroid medication because the medication from my lymphoma doctor impacted my thyroid negatively, and I had to take that medication. And, it just kind of comes out of the blue where one says, oh, your numbers are good, and another one says your numbers are not good. And so you kind of have to figure that out. It's very frustrating. And they're even in the same ownership of group, say, all of these clinics are under one hospital system or something like that. Getting those two doctors together to discuss or communicate about what's going on and what's best for the patient, from where I sit, doesn't happen. Now, you also have the issue with duplicate tests. Now, I take lab work every 4 weeks because of the medication from the doctor that treats my lymphoma. That's fabulous, right? I get a lot of information in that. Well, my cardiologist wants tests, and my primary care doctor wants tests. Maybe the, OBGYN wants tests. I've been really fortunate in every discussion I've had with all of my doctors to say, I have labs taken every 4 weeks. Can we make sure that you look at what those labs are, and if they're sufficient for you, use them? And if they're not, can we add the draw on to when I do my regular tests? Because I don't want to be going into the lab for more blood work or duplicate blood work, because it can get very expensive, because there are different billing codes. There may be, a different cost to me based on those billing codes. You're also getting twice the needle sticks. Obviously, I'm getting a lot of needle sticks, I think, anyway. Once a month feels like a lot, especially when every single lab I have access to goes straight from my left arm. And they are not set up to go to a different arm, which is strange to me because I would think somewhere along the lines they would want to be tracking where all they're drawing from. You have, I have to laugh about some of this stuff, right? Communication black holes. You would think electronic medical records would help, but I'm here to tell you I have not yet experienced that. Basically, we, the patients, become the messenger. Well, Dr. Smith said this, and then watching your doctor frown because they don't know what they're talking about. I actually have one of my doctors who faxes information to my other doctor because they aren't getting it through the system. And this is archaic, to say the least, and it has to be incredibly frustrating for the employees of these medical practices and not just us, the patients. There's also scheduling overwhelm, right? How do you coordinate your labs, your scans, follow-ups, treatments so they don't overlap or you don't end up in 3 different waiting rooms in 1 week? And that's actually something I'm facing this week. I just got back from a trip, and I think I have 3 doctor's appointments scheduled this week, and they're all over the place in the time, and it's like there's no concept of, what might work best for me is we're doing all this stuff through my chart, and I'm like, no, this isn't a good time for me. I get frustrated that my chart has some communication tools there, but nowhere in there when I'm requesting appointments, can I put in times that don't work for me or times that do work for me, right? I want an appointment on a Monday, right? Emotional toll. Honestly, every new appointment is another story you have to tell, another set of eyes looking at your chart, another round of exploring your rare disease from scratch. That could get really draining. I had COVID, Lord help me, maybe 2 months ago now. Maybe not quite that far ago. I've still got the long COVID cough, which is really frustrating. But when I went in about the long COVID cough that would not go away, I end up with a practitioner who has no idea about my lymphoma. So that's fine. Everyone learns. They don't need to know everything. I can live with that. It's just the time that it takes from me, because then I have to explain the situation to a new provider. That new provider, in doing all of the right things, goes in and does the checking themselves about what is this disease, what is this illness, what is this mycosis fungoides that I have. And then they have to look into the medication that I'm on, and then they have to do the research of, can I provide you, my situation was, can I provide you prednisone? Because that's the typical course when the cough has reached this point. And no, I know prednisone is not something that I would do well with. Is one of my doctors and I had discussed earlier, prednisone was sort of one of those things that if my life depended on it, take it. But if not, I need to find another way around it. And that takes time. So that's another 20 minutes in a doctor's office, when you've already got a lot of things going on. Now, there are some strategies that help. And here are some ways I've tried or I've seen others try to kind of do what they can to keep the chaos under control, right? So become your own record keeper is the top one. Know where everything is. Keep copies of everything. Lab results, scan reports, doctor notes. Even if it's just in my chart, know where it is. If you're not a my chart person, make a binder. Print the stuff out, have it, or have a digital folder. And honestly, I would say a binder is probably more helpful because you can walk into your doctor's office with it printed out, and they can flip through and see all of the things without having to find it in my chart. I know I've spent a lot of time in some of my doctor's offices as they're going back through trying to look at the information. So that's something that can be really helpful. Also keep a medication master list, every med, every dosage, and the prescribing doctor for each. And bring that to every appointment. It saves a lot of time, reduces mistakes, kind of prevents the awkward silence when you can't remember the exact milligrams. And I think of some of those videos I see on social media of it's a nurse, and I can't think of his name, funny fellow, but he does short little video skits about what people call their medications when, he's treating and prepping them for the doctor to come in, and he's having to guess from what we call it versus what the actual name is. And it's really kind of funny, and it can make you see how challenging that can be for a medical practitioner and making sure that they get everything right. And I did have one instant recently where one of my medications is the only place in the world that produces it has a backlog, and there's none of this medication available until sometime in 2026, and they're giving vague dates on that. The switching from, I take it from a vial. I have a vial and a syringe and a needle, and I take a certain amount of that vial. And the discussion about could we switch me to a pen because there might be more of the pen medication available. And that's when I learned that just because it's the same medication and just because it's in the same form, by the form I mean a liquid, it doesn't mean that the concentration of medication in the liquid is the same. So in my case, I had a 1 milliliter vial of medication that had 180 micrograms in that 1 milliliter vial. And so I would take half of that 1 milliliter vial each week. So I would get 90 micrograms of medication. Well, in looking at the pen option, the pen had half the amount of liquid is the vial. So instead of 1 milliliter, it was half a milliliter. But it still had 180 micrograms of medication in it, and which is too much for me to take in a dose. I need to take 90. So I hadn't ever thought it's a liquid, it's the same thing, it would be the same thing, and it's not. So those are why it's really important to have the information accurate and handy for your doctors, because that's a big deal. In my case, it would have been twice the dose if I had taken the pen as opposed to the vial. Now, some hospitals, or if you're at a cancer center, offer nurse navigators or care coordinators. I'm not under a kind of treatment where that's an option for me, but some places will have that, especially if you're working with a team that treats your rare disease or chronic illness. So if you can get one, get one. They are lifesavers. They actually help bridge the communication between all the professional medical individuals that you are seeing, and they keep everyone focused and on the same page. It's huge. Obviously, if that's not available, sometimes your primary care physician can serve as a hub for all the information. I just haven't found that to be particularly effective for me. There are also other things that you can do if you're trying to, make sure everything's right. And that's really, I've said this before, advocate out loud. Don't be afraid to say, can you send this note to my other doctor? My other doctor needs to be kept apprised of what's happening. Or I need you to copy my care team on these results. It may feel pushy at first, but you're protecting yourself, and that's really important. You need to advocate for yourself. And no surprise here. Managing multiple doctors isn't just about the logistics of managing multiple doctors. It's about how it makes us feel. Because let's face it, when you got a chronic or rare disease, there's a whole lot of emotion involved. I mean, sometimes I feel invisible, like each doctor sees a symptom, but not the person. Sometimes I feel like a translator. I'm trying to put one doctor's medical language as I heard it into words another doctor will understand. And sometimes, honestly, I feel tired. Like, why do I have to be the one holding all the strings together? And sometimes I get really angry because I am absolutely sick and tired of having to do this. It is, when I say tired, it's exhausting, it's frustrating, it's demoralizing. It can, you feel like you're complaining or whining all the time when you're just trying to get something right and get it fixed and understand it and make your body work as well as it can with the tools that you have available. However, we know our bodies best. I've learned patterns in my labs before anyone else. I've spotted medication interactions because I was paying attention, and I've learned that while it's not fair that I have to manage this, it also gives me some control in a situation where control is scarce. And I chuckled to think a little bit about it. It was years ago, I went to see an ENT, ear, nose, throat doctor, right? Because I had an ear infection. And I went into the doctor, and this is probably, 14 years ago. And he said, so what are you here for? And I said, well, I have, both of my ears are infected. And he said, no, both of your ears hurt. You have no way to know if they're infected. And it really pissed me off. I'll be very direct here. And I said, I've lived with this body a hell of a lot longer than you've seen it, and I know for a fact that I have 2 ear infections because I know exactly what they feel like. And he harumphed, and he looked in my ears, and he said, you have 2 ear infections. Well, no kidding. I knew that, right? I haven't figured it out. I haven't figured out how to manage multiple doctors perfectly. I've found tools that help. I keep trying. I've found ways to make sure my care doesn't fall through the cracks. And most importantly, I've learned that advocating for myself isn't optional. It might tick me off, but I need to do it to survive and to survive well. And if you're listening and juggling your own team of doctors or someone you care for or love is doing the same thing, there are a lot of us out here in the same experience. If you found strategies that work, I would love to hear them, because just as I share my mess here, your insights might be the thing that can help someone else. Thanks for listening to Fine But Not Fine. If this episode resonated with you, subscribe so you don't miss what's next. And if you got a story, question, or just need to vent, reach out. I'd love to hear from you. Until next time, take care and keep on going.